So my name is Professor Allan Pacey and I'm Professor of Andrology at the University of Sheffield. You could describe me as a fertility expert. I spend a lot of my professional time, but also some of my personal time, talking to young people, professional groups about fertility and cancer. One of those is working with the Teenage Cancer Trust and their Find Your Sense of Tumour conferences that happen now twice a year. Sometimes it's very clear that this is the first that young people have actually heard the word fertility mentioned in the context of cancer. Now, that's a shock, that's a surprise, and it's a difficult thing to manage because then I'm the person potentially portraying or bringing bad news to the young person, and that should not have been done by me. But I also think that it's really important that we do talk about this, and we talk about this at regular opportunities, because it's through that drip, drip, drip of constantly mentioning it that means it enters the minds of young people who are wrestling with these difficult issues, but also it enters the mind of professionals and reminds them how important it is to make sure they talk about fertility with young people. In the NICE 2013 guidelines, I was really pleased that we managed to get fertility on the agenda. Now, to make that work and operationalise it, it's really important that care commissioning groups in England, but also hospitals and local health teams, take those recommendations and put them into their management plans for young people. Guidelines only really work when people act upon them, and the guidelines were written to be as clear and as simple as possible. So it is, again, only really through training and only through making sure that oncology teams are aware of this, that we could actually make fertility an important piece of the cancer pathway. So I think it's very important that all young people facing a diagnosis of cancer or another condition where the drugs may affect their fertility are given the option to preserve their sperm or eggs before that treatment commences. It's really critical that that decision is made before the cancer therapy begins, and therefore it's really important that the oncology team have this built into their protocols once the young person enters the hospital or enters the ward. So it's really down to staff training of the oncologist and the oncology team, and I would say it's the oncology nurses who are particularly critical to this working.